Good afternoon, good morning, good evening to you. Welcome to this timely session on enhancing well-being and preventing burnout amongst treatment practitioners. And thank you very much for choosing to spend this hour with us. You know, you could have done many other things with your time, so we appreciate you sharing this with us. I'm Goodman Sbego. I am the scientific advisor at ISSUP, which is the International Society for Substance Use Professionals. So while we wait for more colleagues to join us, I'm just going to say a few things about ISSUP. As you know, ISSUP is a membership organization for the global substance use workforce. We have over 35,000 members worldwide and growing steadily. We are an international network that seeks to unite, connect, and share knowledge across the substance use prevention, harm reduction, treatment, and recovery support workforce. ISSUP's global mission is to make the work of members as impactful, accessible, and effective as possible. And we do this by making it easier to discover and share evidence-based knowledge, best practice, training, and network opportunities. If you haven't done so already, please go ahead and hop over to our website, issup.net. The team is going to throw that in the chat, where you'll find information on how to sign up for the free membership. Our website also has a wealth of other resources and publications for you to browse and engage with and hopefully be enriched by. You can also watch recordings of past webinars and see future event listings. I'd like to thank the ISSUP staff in the background for providing technical support for this event. So before we get started, just a few items so you know how to participate in today's event. You'll have the opportunity to submit text questions to our presenters by typing your questions in the question pane of the webinar interface on your screen. You may send your questions at any time during the presentation, and we'll collect these and address these during the Q&A session at the end of today's presentation. As well, a recording of this webinar will be made available for you to watch on demand after the event. We hope you'll stay with us for what promises to be an illuminating session on a timely focus area. So we focus rightfully on the well-being of our patients or our clients as a key outcome of our interventions. Since COVID-19, we've learned that some essential lessons about the well-being and self-care. The reality is that a crucial part of the care received or experienced by our service users draws from the therapeutic alliance established in the course of treatment planning and implementation. And besides being essential for personal wellness, self-care provisions us to be able to successfully contribute to the establishment of that therapeutic alliance. So this webinar focuses on strategies and practices to improve the personal well-being and resilience of professionals working in the field of substance use treatment, and we're pleased to welcome an old friend to walk us through it. Dr. Natalie Panabokke is a clinical psychologist and senior administrator with extensive experience in substance use treatment and international development. She has dedicated over 12 years to advancing drug and alcohol demand reduction initiatives on a global scale, both with her work at the Colombo Plan, as well as with UNICEF, UNODC, and the Ministry of Health in the Maldives. Dr. Panabokke holds a PhD in cognitive psychology from the University of Sheffield and an MPhil in clinical psychology from the University of Colombo. Natalie, a hearty warm welcome to you. It's a great pleasure to have you with us today, and it's my pleasure to now hand over to you.
Thank you very much, Goodman, and thank you, ISSUP, for inviting me along for this webinar. Hello, everyone. Good morning, afternoon, evening. I'll just get right into it now. Over the past few years, as Goodman was saying, especially post-pandemic, burnout is one of the buzzwords that we hear quite often. It does, however, refer to a very real condition, and I hope that this webinar will be helpful in providing some clarity on what it is and how to address it. Clinical staff turnover resulting from burnout is known to be one of the most challenging issues facing the substance use treatment field. Our work in the mental health field, it can be very rewarding, but it can also be potentially very overwhelming. Treatment practitioners and those working in the substance use treatment services often work under very difficult circumstances. These can involve funding cuts, restrictions to service delivery, lower salaries, and staff turnover can often make work quite difficult. Work occur under very difficult circumstances. And the working conditions, therefore, are harder to deal with and can be quite difficult. And under these circumstances, burnout has been reported as a prevalent problem amongst addiction counselors and other providers of mental health care. The very nature of the work that we do, which can be with distressed individuals over an extended period of time, can lead to burnout, which in turn then is what brings about increase in staff turnover. Burnout itself occurs when you are feeling so overstretched at work that you reach a state of physical and emotional exhaustion. It is defined as a state of physical, emotional, and mental exhaustion caused by excessive and prolonged stress. Burnout symptoms themselves can vary depending on the individual or the circumstance, but in general, there are three symptom areas that we should be aware of. Exhaustion, which is a type of fatigue which presents itself both mentally and physically. So the energy that you might typically have is zapped by persistent exhaustion and generally cannot be addressed by just getting a good night's sleep. This level of burnout goes quite deep into the person's soul. The second one is depersonalization, and this refers to a feeling of indifference. In other words, you might even say that you're feeling numb. For example, you may become more cynical in our inner workings, lack the ability to communicate effectively with people. You might experience indifference and negativity towards work or school or other stresses that can often manifest as a lack of joy or even blaming others for a mediocre performance. Sometimes this is described as seeing the world through rust-colored glasses, as opposed to the rose-colored. That is more often the term that is thrown around. Also, reduced personal accomplishment or performance, which tends to manifest when you feel your work is insufficient and you're incapable of performing your work. For example, then you lose pleasure in the work that you previously received joy from or really enjoyed, and your usual creativity may wane. It can be a lot harder to concentrate, and you might not feel very accomplished due to a lack of reward or recognition, validation. And often people start feeling very helpless and they cannot bring about the change that is necessary. So they are feeling too helpless to enact the change. Burnout during the course of employment can make one feel emotionally drained and unable to function in the context of work and other aspects of life. It can also reduce productivity and lower your motivation, which can then cause you to feel helpless and hopeless and resentful. At work, burnout not only stems from an overload of responsibilities, but can also come from risk factors, such as effort-reward imbalance, lack of autonomy, incongruent values between the individual and the organization they're working with, inequitable treatment, or even poor colleague, supervisor, superior relationships. And when we have these psychosocial hazards at work, many people feel compelled to push themselves to burnout because they feel that if they don't push themselves past that breaking point, somebody else will. So then, you're in that cycle of burnout, which can become quite vicious, and long hours lead to fatigue, which then leads to the disengagement, leading to additional increased pressure, again, going to increase workload, and then this cycle goes on. Originally, the term burnout was applied for work-related stresses, but it can also, now psychologists are looking at burnout as any prolonged stressful conditions. So some of the causes of the life or work factors that contribute to burnout are things like unmanageable workloads, And I can share one of my own experiences here during the lockdown, especially, you know, the initial phases. Or in Sri Lanka, we went through a series of lockdowns where we'd open up for a little bit and then lock down again. And we were all working from home, and it was a period of time where I also increased my clinical psychology caseload in addition to that, the work that I was doing on my regular 9 to 5. And a court, you could almost track it, but the number of patients or the clients that you'd get, the callers you'd get, would peak whenever the lockdowns were implemented each time. And you know, it was a lot of mood disorders, anxiety, and it was work that was very, very rewarding as well. I was able to provide therapy for a period of 2 years, but towards the end of that 2-year period, I found myself getting very irritable. My patience with things around me was getting short. I felt that I wasn't responding to the best of my abilities. I probably also felt like I wasn't really the nicest person to be around. And when I mentioned this to one of my clinical colleagues and also a family member, both unprompted suggested that maybe a break from the provision of therapy would probably be best, because it would have been quite a heavy caseload in addition to my other responsibilities. And obviously, I couldn't just stop because there were ongoing patients, but it did help to reduce the caseload and the hours to get me through that difficult period. So heavy caseloads, intense, it can be a very emotional experience of providing that therapy and treatment. Sometimes a lack of communication or support with managers, immense deadline pressures. One can feel that they're experiencing unfair treatment at work, confusing work responsibilities, when there's a lack of clarity in job roles and descriptions. Some of the other factors that can bring about cases of burnout is when there's too much work and not enough time for rest or downtime, feeling unrecognized, unrewarded. If your work or responsibilities suddenly feel too demanding, the work, you can experience it as being very, very boring or routine, or on the other side, if it's suddenly too chaotic or high stressful, you know, these are all situations that might bring about cases of burnout. Taking on too much without asking for help, the types of cases that you're exposed to, inadequate supervision, lack of support or meaningful relationships, sometimes personality traits such as perfectionism, pessimism, a need for control. These are all things that can bring about situations of burnout in an individual. And burnout can be quite draining. An individual who is feeling burnt out from work might feel constantly swamped or exhausted, tired most of the time. This might be accompanied by physical symptoms, that they might have backaches or headaches, they might lose their appetite, sleep might become very disrupted, they may start to become reclusive and withdraw from others. You might feel, you might experience difficulties in getting things done, and there might be a lot of instances where they're calling in sick to work more often than they should. Confidence can get affected. They might feel like a failure. This is in addition to feelings of helplessness, like there's no way out of the situation, they don't see a way out. Physical symptoms can also include feeling excuse me, tired or drained, lowered immunity, which leads to frequent illnesses, headaches, muscle pain, changes in sleep habits or eating patterns. Emotional symptoms can also include a sense of failure and self-doubt, feeling helpless, trapped, or defeated. Detachment, you get a feeling like you're the only person in the world, there's nobody there to help you. A loss of motivation and increasingly feeling cynical and having a more negative outlook, which can also lead to feeling decreased satisfaction and a sense of accomplishment. The behavioral symptoms, like we've touched upon, include withdrawing from responsibilities and isolating from others, taking longer time to get things done. So there's procrastination, and using substances like food and alcohol to cope with what you are going through as well. Taking out frustrations on the people around you, skipping work or leaving early, coming in late. When looking at the impact all of this that these things can cause, it is generally threefold. There's that individual impact on the counselor and practitioner, leading on from the symptoms that we just looked at. So increased absences and reduced productivity and job satisfaction, lower motivation, and increased mental health issues and other illnesses, high turnover due to an increased likelihood of resignation or looking for other employment opportunities. The high turnover has a direct impact on clients and patients. So clients can experience a variability of service delivery and quality. They could feel like they can rely less on the clinical staff. There could be a decreased quality of care when there's diminished attention to detail, and effectiveness of service delivery can be affected. Communication breakdowns between the client and the therapist, and that disruption of the rapport and relationship could be severely affected due to reduced empathy or reduced capacity to attend to the client's needs, which then ultimately leads to the client losing confidence in the service provider. There's also an organizational impact because burnout can lead to high client turnover and a loss of business. If the clients have a negative view on the service provision, a loss of clients and decreased service quality then impacts the treatment team, which can also get affected. And then there's more negative conflicts and less collaboration, elevated stress levels that can all lead to a very toxic work environment. So when we're looking at burnout prevention strategies in the workplace, we must look at a multifaceted approach involving individual strategies, organizational changes, and policies that support a workplace wellness culture. And these organizational strategies can range from including spaces for reflection and relaxation, promoting a culture of self-care, and actually modeling that behavior by the team leaders and management, having appropriate caseload management, support groups or regular burnout assessments and policies that support and promote well-being, and incorporating well-being into that work environment, into performance, so that well-being also becomes a very important aspect of the employers and the practitioners' work and daily life. I've included a few tools to assess burnout here. I mean, there are lots of tools or little self-assessment questionnaires that you do come across online. You can sort of do a quick one by yourself, but the gold standard is generally the Maslach burnout inventory, which covers the tripartite definition of burnout that we covered earlier, and it is recognized as the leading measure of burnout, validated by over 35 years of research. The burnout assessment tool builds on this to include 4 components. So it looks at exhaustion, mental distance, and cognitive and emotional impairment. And what their view is that a lack of energy impedes the functional capacity to adequately regulate an individual's cognitive and emotional processes, whereas mental distancing serves as a relatively ineffective coping strategy to reduce the exhaustion by withdrawing from work. So building on this reconceptualization of burnout, then the burnout assessment tool by Wilmer Schaffelli and Hans de Witt is also something that is used for assessment. And the next thing that I put on there is the area of work-life survey, again by Maslach and Leiter. I think which assesses employee perceptions of workplace attributes that may determine whether they experience work engagement or burnout. And the resulting profile of scores allows users to identify, say, an organization's areas of strengths and weaknesses. Now, I've included a few references at the end of this presentation, but if anyone's interested in receiving more information on any of these topics, please do let us know, and I'll be happy to send that on. So over the years, the focus has shifted to the importance of mental health and well-being. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not just the absence of diseases. And this involves 5 components. Emotional well-being, which is the ability to practice stress management and relaxation techniques, to be resilient, boosting self-care, self-love, and to generate those emotions that lead to good feelings. Physical well-being, which is the ability, of course, to improve the functioning of your body through like healthy living practices and good exercise habits. Social well-being, the ability to communicate and develop meaningful relationships with others. We don't really function very well individually in isolation, so those relationships that we have with our friends and families, colleagues, they're very important in contributing to our overall well-being and maintaining a support network that can help us overcome loneliness and isolation. Workplace well-being, the ability to pursue our interests, values, and life purpose in order to gain meaning or happiness and enrichment professionally. And finally, societal well-being, the ability to actively participate in a thriving community and culture and environment. To build on our overall well-being, we do need to make sure that all these types of well-being components are functioning to a certain extent. This allows us, all of them contribute to allow us to cope with the normal stresses in life. We're able to work productively and fruitfully. We should be able to contribute to our communities and also form connections and influence the world that we live in. One of the ways that we can take care of ourselves and protect ourselves from burnout is to reach out to others when we are feeling a bit poorly, and instead of withdrawing and then moving in within ourselves, it's very important to develop that strong social network that we can call on, people who we can talk to when we're going through difficult times at work. When I was a clinical intern, we used to have reflection groups because the supervision system, we did have supervision, but there was also, that it was an area that was being developed, and we had reflection groups where all the interns would get together every 2 weeks. And there's a lot of sharing difficult cases, how things made us feel, and it was really helpful in getting us through those very early intern times at the hospitals, which can be quite overwhelming when you're very new to the treatment practice. So we had a network of colleagues as well as supervisors that we could call on when we're going through difficulties or experiencing obstacles, and just that reflection, those talking to each other, you get a different viewpoint, insight, and it really helps to provide that supportive structure. Burnout can make you feel like you're less likely to help yourself, or you're unable to help yourself, and then having that ability or the privilege to turn to your friends and family to talk about how you're feeling, spending quality time with friends and family can be really helpful. It's also quite important to try and socialize with your co-workers if possible, so you're not really feeling like you're coming into work and then hiding away in your office or just being that one person dealing with all the obstacles that life's throwing you through work. Withdrawing in the work environment can feel very isolating and contributes to feelings of hopelessness and depression. Sometimes those water cooler moments or morning coffees at work can be more important than you think. Talking to co-workers, having lunch, avoiding interacting with negative people or people who can increase your stress levels. Sometimes finding volunteer efforts, religious organizations or support groups, so where you can be around or talk to people who enjoy the same activities and share the same values as you. Exercise can be quite important and helpful in boosting energy and mood. Doing some cardio, walking, any other exercise activities that you enjoy can help lighten the mood. Aiming for about 30 minutes a day, or even if it's 10-minute walk outside to boost your mood, can be really helpful in helping you deal with difficult situations. Trying to find something at work that you do that is interesting, that helps you gain a purpose or value. This can also be very helpful in providing people with hope and helping them become more engaged at work. That work-life balance is also so very important, as just being overwhelmed with the workload day in and day out can become very ominous and can lead to burnout and depression. Slowing down, considering your goals for life and work, disconnecting from technology sometimes, picking up a new hobby or an activity. You can't always change the current situation that you are in or your job or your life, but you can try and change the way you feel about it, and finding something that you value in your work, creating that work-life balance, taking a vacation or leave if you can to remove yourself from work stresses, allowing yourself that disconnection when you need it can be very, very helpful. And then in addition, eating healthy is an important way of staying healthy mentally and physically, a balanced diet. Exercise, not depending too much on alcohol and caffeine, which can be detrimental if consumed in excess. These are all things that help us prioritize our mental health and well-being. There's also been strong evidence, and one of the things that was a part of our clinical training was the introduction of mindfulness and the use of mindfulness in a practice to reduce burnout amongst healthcare professionals, also as a form of treatment of anxiety or sometimes even for cravings. And mindfulness can be defined as an awareness that emerges through paying attention on purpose and non-judgmentally to the unfolding of experience moment by moment. So a person who practices mindfulness goes about his or her day being in the present moment, acknowledging rather than judging the events and emotions that they are going through. So specific mindfulness exercises can even include mindful eating. I know that sounds a bit strange, but we go through our daily activities almost on autopilot sometimes. And the practice of mindfulness just tries to slow us down and makes us live in the moment, and while we're eating or brushing our teeth or doing things mindfully. So you can also do sitting meditations, body scanning, or yoga practice, but generally it's something that allows us to reconnect with our bodies and the sensations that we are experiencing. So we're able to pay more attention to the sights and sounds and smells and tastes of the present moment. That might be something as simple as making a cup of coffee and then drinking it, or even the feeling of the banister as we walked up the stairs. But an important part of mindfulness is the awareness of our thoughts and feelings as they happen moment to moment. So becoming more aware of the present moment can help us enjoy the world around us more and also increase our understanding about ourselves. when we become more aware of the present moment or the current situation that we're in, we begin to experience things afresh that we might have been taking for granted earlier. And it also allows us to become more aware of the stream of thoughts and feelings that we experience, and see how we can be, and then, you know, we can see how we sometimes become entangled in that stream in ways that are not helpful to us. Mindfulness would let us take a step back from our thoughts and start seeing patterns. We can train ourselves to notice when our thoughts are taking over and realize that these thoughts are simple mental events that don't have to control us, but we can just let them go and move back into the present moment. Mindfulness can be really helpful in helping us dealing with issues more productively and improving our understanding of our own thoughts and behaviors. Another practice that is quite an easy one to get started is the practice of journaling. And in the introducing journaling into our daily activity, sometimes it doesn't even have to be daily. We can do it every so often, but it is a widely used non-pharmacological coaching counseling practice used for to benefit or improve our physical and emotional health. So you can do this in two forms: expressive writing, which is typically formed over 3 or 4 sessions to access individual clients' innermost feelings and thoughts, which focuses more on the emotional experience that they're going through rather than the events and the people and the objects. You can also introduce gratitude journaling, which involves a focus on the positive aspects of life through capturing situations, events, or interactions for which we're grateful. This could be basically just waking up and noting down 2 things that we're grateful for every day, or like once a week. It's just something that is quite easy to get started, but can be really beneficial to clients that are experiencing a difficult time. So the positive effects of journaling can be felt even when it's not performed daily, but it is very helpful in allowing the individual to better understand their needs and thereby boost their well-being. It can also help us process emotions that lead to better understanding for our situation and maybe help us see a way to proceed. So it's also important to add that if it does seem like the situation is more than burnout that is being experienced and has morphed into mental disorder, mood or anxiety disorder, then it is important to seek professional help. However, which is why I've hoped to highlight symptoms or signs of burnout so that you could watch out for early signs of career burnout, feeling withdrawn or sleep disruptions. And then once you do notice the signs and think, okay, maybe I could use some help, then put some strategies in gear and start working towards a healthier, balanced lifestyle to prevent it from becoming worse. Practicing good self-care does wonders for many facets of your life, both at home, and I do hope that this has been helpful to you and that you can take something away from it. Thank you very much.
Thank you very much, Natalie. You know, I'm sure for many of us who are listening to you now, we were seeing ourselves reflected on so many of those slides. You know, we have a couple of questions, and I encourage folks to keep on sending them, and we'll share them with Natalie. I think you touched on the fact that, you know, we made the shift from working from home and more online during the lockdown period. And we really started to blur the lines, didn't we, between being home and being at work. And so how would you suggest we can actively now start to put in place measures to sort of try and realign ourselves? Because, I mean, look at me now. I'm in an in-person meeting. I've stepped aside to moderate a webinar. From here, I'm going back to that meeting. So we really have started to blur the line. So how do we realign and get back on track?
I think having those practices, like, you know, a lot of it, that waking up in the morning, you know, getting dressed, putting on your work clothes, going to the office, that does that does change that entire mindset, put you in that work mode. Whereas working from home has its benefits. And during lockdown, it was a necessity, and post lockdown, I know a lot of people preferred it, but they were also people who probably had that structure in place. For me, you might have noticed I have a very young family. Sometimes they're in and out. It's very difficult to sort of maintain those things. And when you're at home, sometimes, you know, you get that work call, you get that email, you suddenly respond because, you know, you're not in that form where you're doing all these things on work time. But I think having those distinctions, maintaining that work-life balance, having certain times when you're going to respond to work emails, having certain times when, you know, now you're focused on family, or, you know, your own time when you're reading a book or watching Netflix maybe. But it's just maintaining those structures in a certain way. It doesn't have to be very regimented, but whatever works for you, so that you don't feel overwhelmed, or you don't feel like you're not doing enough in any of the areas. And I think for me, during the time when I was experiencing a bit of burnout, I had my administrative project management work, the client work, my home responsibilities, and until I figured out how I could really balance all of that, and how, like, sometimes maybe it was okay not to do anything. And I think getting to that understanding that you don't have to be responding immediately all the time, that that makes a big difference to you as well. And I would say this to my colleagues. I have a tendency to email when I remember something, but I don't expect an email back immediately. And I think, you know, there are the little things that you have to sort of try out to make sure that you're performing your best in every aspect of your life.
Yeah, you know, the work we do is so geared to and focused towards other people's well-being. And even if we're not directly in the treatment space, the policy work we do, the capacity building work we do is along the same lines. So very often there's a sort of alignment of guilt as well when you don't reply to an email or when you don't complete that task. But I definitely hear you. You're saying let's be more aggressive about putting in place those separations and making sure that we create activities that pull us out of work and allow us to sort of get in touch again with ourselves.
And I think we just perform better in all aspects. So it's not a case of, you know, don't do the work, but taking that little break from work will actually make you perform better in the long run. So then your productivity is increasing. Whereas just if you're pushing yourself to burnout, or if you're pushing yourself, you're not really being the best that you can be in any part of your life. And that's something that I think is hard for a lot of people to realize and accept. But I just think we would be a lot better if we have a balanced approach to everything that we do.
So a question, comment/question from Nivendra and Uduman. I hope I've said your name correctly. Working in the area of substance use can sometimes be quite difficult due to resource poor settings, no-shows to appointments, and other barriers, especially in certain countries where adequate supervision may not be available. This can lead to practitioners to be critical of themselves, very important reflection, Navendra, and to personalize what might be happening in the treatment space. So how do self-compassion practices come into play, in your opinion, Natalie, in the context of bolstering resilience and well-being to practitioners?
Well, I mean, this is something which I was hoping to address with this topic, because I feel it is very important for practitioners to realize that, you know, we can't be everywhere, we can't be everything, we make mistakes, we provide we need that time for to rest and recuperate and build up our skills as well. And supervision in Sri Lanka, where Navendra and I are both from, supervision is an area that can require a lot of work, and it is important for us to sort of almost go through our own therapy. Definitely when if you come up with a situation where it is quite difficult for you to grapple with, I think the importance of speaking to somebody, maybe professionally, getting that supervision, getting that support from that work environment, or even a reflection group or something with colleagues, some sort of outlet is very, very important in helping an individual treatment practitioner realize that they can't be everything for everyone all of the time, and because that can also be exhausting, emotionally draining for an individual. And that sort of acceptance, you learn it as a clinical trainee, there's guilt, there's going to be this, but those are all things that we have to become quite comfortable with the understanding that, if we don't do that, we are less productive, we're less helpful to our clients, to our patients. So by taking those necessary steps and maintaining the balance, seeking supervision or counseling ourselves, they're all designed to help us be the best therapist, the best practitioner to our clients.
Thanks, Natalie. Shirley just made a comment, so not a question. She says she wants to congratulate the speaker for such a practical and useful presentation on how to combat burnout in the workplace. Indeed, very effective for all settings. So thank you, Shirley, for that acknowledgement. Mohammed Kabir wants to know what your thoughts are, Natalie, on how often can we get a break while working in the office to fight burden and exhaustion? So, what's reasonable? I know it's not always up to us, but what are your thoughts?
Again, it is not always up to us. I can tell you what it's like for me in a 9-to-5 position. I find it very difficult to concentrate for, like, say 2 hours, 3 hours at a time. So I would always maybe not always to these was not very appreciated by my colleagues, but I sort of do a walk around or have a chat with somebody. So giving me a little bit of a break. And I find, going for a little walk around, maybe a chat with somebody else, having a coffee, just sort of to break that monotony sometimes, for the lack of a better word, just gives you that little, almost a rejuvenation, so you can get back into it. I know when I had to do budgets and things, I'd always need a break every so often, so that I was looking at things with almost a fresh light, so that I was doing that the best I could. And I think it's important to take those breaks or include whatever helps you maintaining that balance, be it like going out with friends or going introducing an exercise class, yoga practice. I think it's important to find what works and make sure you have a well-balanced life that would help you be the best you can be in your work environment as well.
Thanks, Natalie. Mahmoudou Jallo has a question which actually aligns to something I was wondering about while you were speaking about. So my question was going to be around how well prepared do you think we are in our training to be able to provide self-care and to provide for self-care spaces in our functioning. But Mahmoudou's question is, what role does ongoing professional development and training play in preventing burnout among substance use professionals? And if, in the event that it was something that could be better incorporated, what topics in your view should be prioritized?
I think, to answer that last bit first, I think what's really helpful is to provide like little actions or exercises or activities that can actually be used or implemented really easily. So what I was trying to introduce by mentioning, say, journaling or mindfulness, those are things that you can sort of incorporate in your daily in your day without too much difficulties. Whereas or going for a 10-minute walk, just I think it's important to introduce easy things that can be incorporated when you're talking about quite heavy topics. It's good to leave people with something that they can quite simply include into their lives. And I think including well-being practices like that in professional development is something that I think maybe organizations are aware of and are including now, not so much maybe when we were in training. They would tell us, you know, it's very important to be supervised, it's very important to maybe go through therapy yourself, have all these things, a reflection group, having, you know, safe spaces for getting together and chatting. They all sound very nice, and there are things that organizations are trying to include now because they're aware of the importance of cases of burnout and well-being, so they protect the clinical staff themselves. But in actual fact, it is a very new area where, you know, I think there's a lot of work, but what is uplifting is that it's not an area that is being ignored. So I think it's being brought more in the forefront, and which is also what I was hoping a webinar on this topic would bring about.
Thank you. So Anima Kamal and Benjamin Rudolph's questions align in many ways, and I think linked to what you've spoken about now in terms of structure in the workplace to alleviate burnout. So I'll start with Nima's question. She says, thank you for the insight. In relating to the questions asked earlier, what policies can be put in place to make sure that burnout is reduced or non-existent? And then if I link that to Benjamin Rudolph's question, Benjamin wants to know, can you say something about getting clinical administrators to be more open to advocating for self-care for the clinical staff, as it's often forgotten and ignored? So these are really questions around structural enablers.
I think organizations do try. It is hard, especially in responding to the client base, the loads, caseloads. So, you know, including that professional development, focusing on areas where they do have to sort of try and incorporate it into that practice in the organization, where, you know, maybe they monitor the caseloads, or they there's leave entitlements have to be taken, some sort of break from that work environment. You know, a lot of the time we work 9-to-5 jobs, or if you're in a residential treatment center, it's a bit different. And sometimes, you know, things that are applauded is if you're in the office at 7 o'clock, and those, and in some cases, you know, you might need to be, but like trying to promote those, you know, set times, or saying, okay, look, how are you doing, checking in, doing those burnout assessments, maybe promoting less working hours, or if somebody's in the office till 9 o'clock every night, like what's going on, is it too much? That sort of open chat, or even having like a group where you can go to your supervisor, provide provision of supervision, can all be very helpful. And I think people are trying to do it. It's just there's a lot that can be done, and there's room for it. I mean, sometimes it's just a case of should we get together for lunch or a coffee, and then everyone just chats, and that's, you know, they're not talking about work, they're talking about something else, and that can be quite helpful. Like little things as a start can be very helpful as well.
Awesome, thanks, Natalie. So to just intermix with a reflection from Josephine. So she says, thank you for the wonderful presentation. It's therapeutic. Sometimes the helper needs help, and we all know this. I could use some sleep and some help myself right now. She says she was actually going through a lot from work burnout and personal related stress, and was looking out to seek help. And with this presentation, she feels healed. Josephine, that's really wonderful to hear. So we're really pleased to hear that. Thank you. Tema has a question which is interesting. Tema says the research shows a double role of empathy in burnout. This is interesting, Tema. I haven't come across this before. So on one hand, empathy prevents burnout, right? And on the other, empathy predicts burnout. I don't know if you have any view about this, Natalie. What's your opinion?
I mean, it's very interesting. I'm also not familiar with this area of research, but I have noted it down because I'd like to read more about it. I mean, there's a link, obviously. Everyone, generally treatment practitioners, counselors, they have high empathy. And when you're going through a lot of, say, when you are treating clients and patients, almost absorbing that or taking that on, that reflection, quite exhausting and emotionally quite heavy, which is one of the things that can lead to burnout. I'm not sure about the links that Tim was mentioned, but it is an interesting area that I would like to read more on.
Absolutely. I mean, I certainly would imagine from the prevention side that if you feel you're in a workspace where you can be heard and you feel you can rely on colleagues and on your line manager to hear you out when you're struggling, that might prevent it. I wonder if the other side of it is about feeling guilt, you know, because you have somebody who's empathetic to you in the workspace, so really wanting to do the best. So I'm not sure. So I think, Tema, both Natalie and I will certainly look into that and see what we find. So thank you for raising that for us. Happiness's question says, what should a health provider do once he or she has met with a trauma exposure? I would imagine this is probably side by side. What's your thoughts, Natalie?
I'm sorry, trauma exposure or?
Yes, what should a health provider do once they have met with a trauma exposure? I imagine this would be in the context of how it might contribute to their wellness and contribute further to.
So ideally, you know, supervision, counseling, that absorption of secondary trauma, and also that's kind of where that supervision and the extra support with your line manager, with your supervisor, is really helpful. So you talk that through. Is what would happen in an ideal world. Again, if you don't have that, talking through with colleagues, reflection groups where you're sharing that experience, so you're not keeping it in you, but you're able to sort of vocalize it, or even if this is not ideal, but journaling can help with that sort of thing as well, when you're just writing it out. And it's something that we often do with PTSD treatment, where we sort of write down the narrative of an episode, and that can also be really helpful in helping us process those heavy emotions and help us sort of absorb it and like move on, so that we're not consumed by the trauma.
Yes, so there's a question that Nivenjan asked, and now I can't find it, but I remember what it was, so I can ask it. So he was, oh yes, there it is. So he wanted to know, and I did make a quick response to him when I saw his question. How does one differentiate burnout and what we call clinical depression? You know, I mean, one could argue that it's a spectrum in both directions, right? So what are your thoughts on that?
So I was going to include this in the presentation, but I felt maybe the timing wasn't enough. But that there's a distinction between burnout and stress, and as well as burnout and depression, which is why I sort of touched on whether you think if it's going on for too long, and whatever you're experiencing has developed, it's important to try and then go seek professional help and go see your supervisor, psychologist, psychiatrist to help but I mean, what I would say is what I was trying to do was increase awareness about the topics. There is an overlap. Those feelings of helplessness, that detachment, the symptoms are kind of the same. With burnout, you know, what if we are able to get a bit of distance or include the different components or strategies, and it helps, then, you know, we are able to then move on productively. But if it's not being very helpful, then I would think it's good to go and see if it's a diagnosis of depression or a mental health disorder rather than just a case of burnout, which can really feel like it's the same thing. So always having those avenues to seek help and get support, talking through your experiences, putting those strategies in place, and then seeking professional help whenever necessary. Because what I wouldn't want to do is say, okay, it's just stress, or it's burnout, or it's depression, but you know, they're all kind of linked, and it is very difficult to tell sometimes. But what I was hoping to do is, if we're aware of it and the strategies, we can put some things in place. If it doesn't help, then maybe seeking professional help is the way to go.
Absolutely. So a reflection from, let me get the name right, from Benjamin. So Benjamin says he runs a non-profit organization which provides interventions and support for folks with drug dependence in marginalized communities, and the fight and competition between NGOs for funding really adds to the stress, and the lack of support which you mentioned you know, really adds to the volume. I think you've provided some tips on self-care, so Benjamin was just wanting to ask for some of those. So I think hopefully the ones that Natalie has mentioned, you know, especially around journaling and around mindfulness activities. And I think one of the things we forget in our space is that we, as much as occasionally might be in competition with each other, can actually also be a support network for each other. I don't know if you have any reflections on that, Natalie, as our last question.
I think, as you say, Goodman, that support network, you know, we work in competition a lot of the time, but we're also going through the same things, and sometimes providing that support, having those structures set up can be really helpful, so we are able to use it not just as competition but to help us along, and I'm sure they'd be very appreciative of it also. But also little things like exercise, getting some time away. I did have like a different things that we could put in, and then, you know, the mindfulness and journaling, but there are lots of different ways that we could incorporate it to address these issues of burnout in our daily practice.
Thanks so much, Natalie. I think what you've presented today, as reflected in the comments and the response that we've received in the chat and the comments and the questions, is really something that's topical for all of us, and that at one time or another has affected or is affecting us. So thank you so much for that great overview and for tackling some of the questions. It always happens that as more questions come in, they multiply. So suddenly we can't get to all of them. So I'm sorry, and I really appreciate your attempt to engage us. So colleagues, that does conclude this webinar. Thank you for attending. We hope that you found the session helpful and relevant to your own well-being and to the well-being of your colleagues and how you'll engage with your workspace. I really appreciate that Natalie took us through this. You will receive a follow-up email in the next 24 to 48 hours with a link to the recording of today's webinar. And we always appreciate your feedback and suggestions. So please do go ahead and use the link in the follow-up email. Please fill up the survey, tell us how we're doing. On behalf of ISSUP and on behalf of Natalie and myself, thank you so much, and we wish you a great rest of your day. Goodbye.
Bye.